Hello dear aspirants, welcome to Ganesh Nursing Academy once again. So last class we were discussed about important MCQs, okay, on ECG. So we had discussed about 17 questions. So now let's continue discussion of important questions on ECG, okay. So let's continue with the question number 18. Question number 18, identify the given image type of arrhythmias. Okay, so they have given the image here and it is a image based questions. They ask you to find out what is the type of arrhythmias it is. Okay, option A is a sinus arrhythmias, option B tachycardia, option C is a sinoatrial block, option D is a premature ventricular contraction. Okay, so whenever they give a image based questions, you have to see closely, observe the image. Okay, what anything wrong is this in this image and what is the type of a rhythm it is. So we have to closely observe and then we have to make a we have to read all the options and we have to find out the right answer for this one. Okay, so here when I observe this image, here there is a P, Q, R, S, T. It is a normal rhythm, and here you can see here there is an abnormal rhythm here. Okay, abnormal ectopics. Okay, I can see here an abnormal ectopics. Okay, and again here P, Q, R, S, T, and here again a abnormal ectopics I can see here. So I could see here there is a some ectopics are present in between the normal view. And what is this type of arrhythmia they asked? Okay, so first one is sinus arrhythmias. Okay, sinus arrhythmia means this is not a sinus arrhythmias obviously, because what are the changes in sinus arrhythmias? Here there will be P, Q, R, S, T. Okay, there will be P, Q, R, S, T. Okay, then again there will be P, Q, R, S, T. Okay, P, Q, R, S, T. Okay, see here, this is the P, Q, R, S, T, P, Q, R, S, T. Okay, here P, Q, R, S, T, P, Q, R, S, T. Okay, so here the distance between two consecutive P wave and R wave, it is shortened here, and the distance between two consecutive P wave and R wave, it is widened here. Okay, so the distance between two consecutive P wave and R wave, it shortens during the inspiration. Okay, during inspiration it shortens. Okay, and during expiration, that is exhalation, the distance between two consecutive P wave and R wave, it widens. So this pattern of rhythm, it is known as the sinus arrhythmias. Okay, so what happens here when you find out the atrial heart rate and ventricular heart rate during inspiration, the atrial heart rate and ventricular heart rate, it increases. Why it increases? Because number of small cubes, okay, number of small squares between the two consecutive P wave and R wave will be less. Okay, for example, between this one, if there is only 15s are there, okay, so 1500 we will use. So there is only 15 small squares are there. Okay, 15. So 15 on the 15 on the. So heart rate during inspiration is 100 per minute. So heart rate during inspiration is 100 per minute. Okay, so when we count the heart rate, okay, either atrial heart rate or ventricular heart rate, but during the expiration, what happens here? 1500 will keep a constant. Here, the number of small squares may be 20. Okay, so 20. So it is 75 beats per minute. Okay, so this kind of arrhythmias, it is known as a sinus arrhythmias. It is known as sinus arrhythmias. Okay, so what is a sinus arrhythmia? What happens in sinus arrhythmias? The distance between two consecutive R wave and the distance between two consecutive P wave will shorten during the inspiration. Okay, during inspiration, the distance between consecutive R wave and P wave is shortened, and the distance between two consecutive R wave and the P wave will widen during the expiration. So that is the reason why during inspiration heart rate will increases, during expiration heart rate will decreases. So this pattern of rhythm is known as a sinus arrhythmias. Okay, so here we cannot see, we are not able to see such kind of changes. So it is not a sinus arrhythmias. It is not sinus arrhythmias. Okay. Now let's see option B. Option B, it says that a tachycardia. Okay, so in tachycardia there is no much changes here. Okay, so here P Q R S T, P Q R S T, P Q R S T. So in this sinus tachycardia, or sinus tachycardia, the distance between two consecutive R wave, okay, or the distance between two consecutive P wave, okay, that is P wave here, P wave here, okay, the distance between two consecutive P wave and R wave, it is shortened, okay. So that is a nature of rhythm, that is a ECG pattern in sinus tachycardia, okay. So when the distance is shortened here, either you calculate atrial heart rate or ventricular heart rate. Because the distance between two consecutive P wave and R wave is shortened, number of small squares will be less, okay. For example, number of small squares may be 15 for both of these, okay. So 1500 divided by 15, okay, the heart rate is 100 per minute, okay. So here there is no morphological changes. P wave will be normal, QRS complex, ST segment and T wave, everything will be normal, okay, and there is no problem in the rhythm, there is no problem in the configuration, there is no problem in the conduction. Only the thing is that the distance between two consecutive R wave and distance between two consecutive P wave is shortened, so that will increase both atrial heart rate and ventricular heart rate. So this is a sinus tachycardia, okay, or tachycardia. So this also you cannot see here, because you are seeing here ectopic rhythms, okay, between the normal ECG there is ectopics. So this is not a sinus tachycardia. What I discussed, this one is a sinus tachycardia, okay. Now let us see next option. Okay, students, next option, option C, sinoatrial block. Okay, so what happens in sinoatrial block? This is a heart, okay, let's draw a heart diagram, okay, and here we have atrial septum and this is the ventricular septum. Here we have superior vena cava and this is the SA node, which is located just below the superior vena cava. This is SA node. SA node is sinoatrial node, okay. So here we have AV node, AV node. So what is this sinoatrial block? Sinoatrial block means there is a blockage in the transmission of electrical impulses from sinoatrial node to the atrial chambers. Okay, there is no proper conduction of electrical impulses from the SA node to the atrial chambers. So there is no proper conduction of electrical impulses from SA node to the atrial chamber. So because of this, what happens here? There is no excitation of atrial chambers. There is no atrial contraction. So because of this, normally the P wave is a indicator of atrial activity. So this P wave is absent in case of sinoatrial block. Why? Because there is no proper transmission of electrical impulse. There is no proper conduction of electrical impulses from SA node to the atrial chambers, and there is no proper atrial contraction. So because of this, there will be disappearance or missing of a P wave. Okay, sometimes there may be missing of P wave as well as followed by QRS complex. So there is complete miss of P wave followed by QRS complex. So this will lead to complete miss of a beat. Okay, so there is a complete missing of beat will happens. So that also you can notice in the case of sinoatrial blockage. Okay, sinoatrial block. And what is the pattern of ECG in case of sinoatrial block? Here there may be absence of P wave. Okay, there may be QRS complex followed by T wave, Q R S T. Again there may be Q R S T. Okay, Q R S T. So the P wave, here the P wave is missing. P wave is missing here. Okay, so it indicates that there is no proper conduction of electrical impulses from SA node to the atrial chambers, atrial wall. Okay, so because of this, there is no proper excitation of atrium and there is no proper atrial contraction. So because of this, the P wave which indicates about the atrial activity is completely missed here. Okay, sometimes what happens here, there may be absence of P wave, QRS complex will be there followed by T wave, and there is complete missing of beat. Again there will be QRST. Okay, QRST complex. QRST. Okay, so here QRST, here QRST. Here supposed to be there should be P wave and QRS complex. P wave and followed by QRS complex should be followed here. So this is completely there is a complete missing of P wave and QRS complex. So entire it will show complete missing of a beat will have. Okay, so this all the classical manifestation of a sinoatrial blockage. Okay, so when you see this image, you will see there is a presence of P wave all over the ECG pattern and there is no absence of a PU. So this is clearly indication that this image is not a sinoatrial block. Okay. Next we'll see last option, that is a premature ventricular contraction. Okay. So premature ventricular contraction, what do you mean by premature ventricular contraction? See, this is a diagram of heart. Okay, this is atrial septum, ventricular septum, superior vena cava, inferior vena cava. Here we have SA node. Okay, SA node. Here we have AB node. AB node. Then this will have a bundle of his. Okay, bundle of his. And here we have a Purkinje fibers. Purkinje fibers we have. Okay, right and left Purkinje fibers. So what happens here? First, the SA node will begin the atrial activity, electrical activity, and those electrical activity are conducted by both atrial chambers. Okay, and then what happens here? Both atrial get excited or contract, and there is appearance of P wave. Okay, this P wave indicates a normal atrial activity. Okay, then what happens here? When atrial contracts, both atrial chamber contracts, the blood will move from atrium to the ventricles. Okay. So during the filling of both ventricles, right ventricle and left ventricle, there is a transmission of electrical impulses from SA node to AV node, then AV node to bundle of his, then bundle of his to Purkinje fibers. So by the time both ventricles are filled with the blood, there is a transmission of electrical impulse from SA node to AV node to bundle of his, then bundle of his to Purkinje fibers. Now what happens here? Both ventricles contracts. Okay, contraction of both ventricles takes place, and there is a ejection of blood from right ventricle into the pulmonary artery, left ventricle to the aorta. So this will give rise to QRST. Okay, QRS. So QRS, okay, presence of QRS complex indicates ventricular depolarization or ventricular contraction. So followed by T wave. T wave indicates ventricular repolarization or ventricular relaxation. Okay, so this all activity that will take place. But what happens in case of premature ventricular contraction? So before these two ventricles, before this right ventricle and left ventricle are filled with the blood. Okay, before these two ventricles are filled with the blood, there is a premature light ventricular contraction. Premature, okay, poor contraction of ventricles. Premature weak contraction of ventricles. So this will show there is a little amount of blood will be ejected from the left ventricle into the aorta, and that pulse can be felt in the carotid artery. But the contraction is so weak that that will not give rise to sensation of any pulse in the peripheral arteries like a radial artery, brachial artery, or femoral artery. Okay, so that pulse can be felt only in the carotid artery or in the apical pulse. Okay, and because of this, the number of pulse rate in the carotid artery will be more, like 4 to 5 more than the radial artery. So this is known as pulse deficit. So this is known as a pulse deficit. So pulse deficit is basically because of there is a weak contraction between the normal contraction, between the normal heartbeat, there is a weak light premature contractions. Okay, and these weak light premature contractions are because of there is some wall of the ventricle, some part of the wall of the ventricles are producing the electrical impulses. Okay, so the electrical impulses supposed to be produced by only specialized mass of cells like Purkinje fibers and AV bundle of his and AV node, SA node. But here what happens here? Apart from the Purkinje fibers, some other walls of the ventricles are producing the electrical impulses. So that electrical impulses gives rise to premature contraction. Okay, premature weak contraction of ventricles. Okay, so this will lead to give rise to this kind of ectopics. What you see, no? This kind of ectopics, and that is what it will lead to a weak contraction between the normal contraction, between the normal strong contraction, between the normal contraction. So there is a weak light contractions will take place. So this is known as a premature ventricular contraction. Premature ventricular contraction is also known as a ventricular extrasystole. So one more name of premature ventricular contraction is ventricular extrasystole. Okay. So because of this weak contraction in between the normal strong contraction, so this will give rise to an extra pulse in the carotid artery. Extra pulse can be felt in the carotid artery. Okay, so that cannot be felt in the radial artery, femoral artery, or tibial artery. It is not felt because that much amount of is not ejected by the left ventricle due to the contraction is very weak. Okay, and that can be felt only in the carotid artery. Okay, and not in the radial artery or femoral artery. So this will lead to a variation in the pulse rate in the, when we measure from the carotid artery, like central carotid artery or apical pulse, and when we measure the pulse rate in the radial artery. So in the measurement of pulse rate in the radial artery will be less when compared to the measurement of pulse rate in the carotid artery. So this extra weak pulses we can feel it because of this premature ventricular contraction. The name itself, premature ventricular contraction, it says that there is a prematurely, okay, before these two ventricles are completely filled with the blood, there is a premature contraction of a ventricle, premature weak contraction of ventricles. So this is known as premature ventricular contraction, and this kind of ectopics, okay, like a broad QRS complex and inverted T wave. So these kind of premature ectopics we can see in the normal, okay, PQRS complex, normal, between the normal rhythm, this kind of ectopics you can see. So this is known as a premature ventricular contraction. Okay, so hope the option A, sinus arrhythmias, is the wrong option here. This image is not belongs to sinus arrhythmias. This image is not belongs to tachycardia and not belongs to sinusoidal block. It is a right option is option B, that is a premature ventricular contraction. Okay, I hope this concept is clear for you. Okay, dear students, let's see next question. Question number 19. Identify the type of premature ventricular contraction in a given image. Okay, so the given image of premature ventricular contraction, it is an image of premature ventricular contraction, but we have to find out which type of premature ventricular contraction it is. Okay, so already in last questions we have discussed, whenever there is ectopics, okay, these ectopics are present, okay, if these ectopics are present in the normal waves, it is known as a premature ventricular contraction. So this is the image of premature ventricular contraction, PVC, but we have to find out which type of premature ventricular contraction, which type of PVC. Options are PVC couplets, option B PVC bigemini, option C PVC trigemini, and options D PVC quadrigemini. Okay, so let's see what is a PVC couplets. Okay, so PVC couplets means there will be normal P wave, QRS complex, okay, and T wave. Then when you see two ectopics, okay, couple of ectopics, when they are present in between the normal rhythm, normal beats of heart, okay. So this is P, Q, R, S, T. Okay. See here, this is a P wave, Q, R, S, T. This is normal wave. So this is the ectopics and this is the ectopics. Okay. Again, you can say P, Q, R, S, T. So this is a normal rhythm. This is normal rhythm. In between normal rhythm, there is two ectopics. Okay, couple of ectopics. Okay, there are two ectopics have entered. They are present between the normal beat, normal rhythm of the heart. So this is known as a couplets. Okay, that is a PVC couplets. Whenever we find two ectopics, they present consecutively. Okay, in between the normal waves, two ectopics are present consecutively. So this is known as a PVC couplets. Next, what is PVC bigemini? Okay, PVC bigemini means this is the normal wave. Okay, and then there will be ectopic beat. Then again there will be normal wave. Then there will be again a ectopic beat. Okay. See P, Q, R, S, T. Then here P, Q, R, S, T. Okay. So what is PVC bigemini? PVC bigemini is nothing but the normal one normal rhythm will be there, one ectopic rhythm. Okay. Then one normal rhythm, one ectopic rhythm. Okay. So every second rhythm, every second beat will be ectopic beat. Okay. So if we find one normal wave, one normal rhythm, and one ectopic beat, alternatively normal beat and ectopic beat, it is known as a premature ventricular contraction bigemini. Okay. Bi means second. So every second beat will be ectopic beat. Normal beat, second beat will be ectopic beat. Then for normal beat, second beat will be ectopic beat. So if you find a normal beat or normal rhythm followed by an ectopic beat, normal rhythm followed by ectopic beat, so this kind is known as a PVC bigemini, premature ventricular contraction bigemini. Okay. So this is not a right answer here. Both couplets is also wrong and bigemini is also wrong. Okay. Now let's see third option, PVC trigemini. What is PVC trigemini? So what is the image which is given is a PVC trigeminy. Okay, so here, see here, this is a normal waves, normal rhythm. Okay, second rhythm is also normal rhythm, and third beat will be ectopic. Okay, so PVC trigeminy. Trigeminy means every third beat will be ectopic beat. Okay, see here, normal rhythm. First one is normal rhythm, second is normal rhythm, and third beat is a ectopic beat. Again normal rhythm, and here the third beat will be, here it will be ectopic beat again. Okay, so when we find two beats are normal and every third beat is a ectopic beat, so this is known as a PVC trigeminy. So this is a right option. Okay, PVC trigeminy is nothing but a two beat will be normal followed by third beat will be ectopic. Again two beat will be normal, third beat will be ectopic. So every third, so that is why it is known as a PVC trigeminy, means every third beat will be ectopic beat. So that is a right option here. Now what is a PVC quadrigeminy? So PVC quadrigeminy means what I will say, there will be QRS complex followed by T wave, Q. So there will be three normal rhythm. Okay, three beats are normal. P, Q, R, S, T. P, Q, R, S, T. P, Q, R, S, T. Okay. So after three normal rhythm, there will be an ectopic beat. Okay. So this ectopic beat. So when the ectopic beat that is present after normal three rhythm, after normal three beats, if you find a ectopic beat as a fourth beat, if you find an ectopic beat, so it is known as PVC quadrigeminy. Quadri means fourth one. Okay. So every fourth beat will be ectopic beat in case of a PVC quadrigeminy. Okay. Apart from this, there will be triplets also. Okay, triplets, quadruplets. Triplets means what? Here, apart from these options, there will be triplets. Triplets means what happens here? There will be P wave, Q, R, S, T. Okay. So here what happens here? There will be ectopic beat. There will be ectopic beat and ectopic beat. Okay. So three consecutive ectopic beats are present in between the normal beat. Okay. So this is P, Q, R, S, T. So when we find three ectopic beats between the normal beat, between the normal rhythm, okay, so this is P, Q, R, S, T. If you find a three ectopic beats between the normal beats or normal rhythm, they are known as a, okay, triplets. This is known as triplets. Okay, PVC triplets. That is a three consecutive ectopic beats. Okay. So likewise, in between the normal rhythm, if there is a four consecutive ectopic beats, okay, apart from this one more beat is a ectopic beat. Okay, so this is known as a quadruplets. Okay, it is known as quadruplets. Quadruplets is nothing but a, in between the normal beats, if there is a four consecutive ectopic beats are present, so they are known as a quadruplets. Okay. And what if there is only continuously ectopic beats only is present? Okay, what if there is only, see here, consecutively ectopic beats only present here, there is no normal beat at all. So this continuous consecutive ectopic beats, okay, so this is known as a ventricular tachycardia. It is known as a ventricular tachycardia. Okay. Now it is known as a now it is not known as a premature ventricular contraction because all beats are ectopic beats. So all beats are ectopic beats. The beats are very weak contraction and rapid contraction. So that is why it is known as a ventricular tachycardia. Pulse rate will be more than 140 per minute, and heart contract very weak contraction will be there, and patient will have a loss of consciousness, and there will be sudden cardiac arrest and death of the patient can happen when patient runs with a continuous ectopic beats. That is known as ventricular tachycardia. Already I have discussed ventricular tachycardia in last discussion of MCQs. Okay, so when ectopic beats continuously, if there is occurrence of ectopic beats, okay, so that will show very little contraction from the heart, and there is a poor ejection of blood from the ventricles. So that causes a sudden loss of consciousness, collapse of patient. There is it may be complicated with the cardiac arrest, and death of the patient can happen immediately. Okay, so this is known as ventricular tachycardia. So this is all about a premature ventricular contraction. Okay, so the answer for this one is, here there is a two normal beats are there, two normal rhythm followed by, okay, ectopic beats, then two normal beat and followed by ectopic beats. So this is a PVC trigeminy. So option C is the correct one. Okay, so option D is also wrong here. Option C is the right answer for this question. Okay, dear students, let's see next question. Question number 20. Which of the following is a serious complication of atrial fibrillation? Okay. So option A, ischemic stroke. Option B, pulmonary embolism. Option C, myocardial infarction. Option D, all of the above. Okay. So what happens here in case of atrial fibrillation? Okay. So in atrial fibrillation, what you can see here, in case of atrial fibrillation, okay, this is the SA node, okay, this is the AV node, So in case of atrial fibrillation, okay, so in this atrial fibrillation, so actually the SA node should produce the electrical impulses, and that produced impulses should spread over both atrial chamber, and then contraction of atria take place. That will show appearance of a normal PVO. So PVO indicates a normal atrial activity. But in case of atrial, okay, in case of atrial fibrillation, what happens here? Instead of SA node, or in addition to SA node, some other atrial wall ectopic beats will, okay, some other atrial wall beats the electrical impulses. It will produce the electrical impulses. So this will show what happens here. There is a atrial fibrillation. So what happens here in atrial fibrillation? You cannot see the normal PVO. Instead of PVO, there is an irregular wave will be there. Then there is a QRS complex, then T wave. Then again there is a irregular waves, QRS complex, then T wave. Okay. So this kind of irregular waves in place of PVO, if you find, okay, there is supposed to be PVO like this, but here there is a irregular waves. Okay. So this is a one of the indicator of it is a atrial fibrillation. Okay. So what happens if patient runs with the atrial fibrillation? The atrial heart rate is rapid. Atria is beating very fast. Atria is beating very fast. Okay. There is a weak contraction, weak and rapid contraction of atria. Okay. There is a weak and rapid contraction of atria, and there is a normal contraction of a ventricle. Okay. The ventricles are contracting normal, but only there is a weak and rapid contraction of atria. Okay. As there is a good contraction of ventricles, the patient will not lose consciousness and collapse of patient will not take place here, because ventricles are properly functioning. Ventricles are functioning properly. So what is the complication of this atrial fibrillation then? Okay. So because of this atria are contracting very weak, what happens here? There is no proper movement. There is no proper movement of blood. Okay. There is a slight stasis of blood will take place. The blood will start accumulating, slight stasis because of weak contraction. So that will show what happens here. There is a formation of clot. So the clots are formed in the like a right atrium and left atrium. The clots are formed here. Okay. So right atrium and left atrium, there is a clot formation. So gradually this clot will dislodge from the wall of the right atrium and left atrium and enter into the right ventricle and left ventricle. So then what happens here? After the contraction of right ventricle, this clot will move into the pulmonary artery. Clot will move into the pulmonary artery, and it may block the pulmonary artery or its branches. So this will block this. So gradually what happens here? This clot will come here, and this clot will enter along with the blood. It will enter into the pulmonary artery, and it may block. Okay, it may block the one of the branch of pulmonary artery or pulmonary artery itself. Okay, so this is known as a pulmonary embolism. So pulmonary embolism is a serious complication of atrial fibrillation. And next, what happens here? If because of weak contraction of atrium and stasis of blood in the left atrium, if there is a formation of clot here, so this clot will gradually dislodge from the wall of left atrium, and it will enter into the left ventricle. This will enter into the left ventricle. The clot is entered from left atrium to the left ventricle. So after that, what happens here? Left ventricle contracts. So after the contraction of left ventricle, what happens here? This clot. Okay, so this clot may go along the aorta. Okay, so this clot will go along the aorta for the peripheral perfusion. Okay, so this clot may go to the carotid artery. It may go to the carotid artery, and it may block. Okay, it may block the one of the cerebral artery. It may block the one of the cerebral artery, leading to ischemic stroke. It may cause ischemic stroke because the clot was present in the left atrium. Okay, so this clot is formed because of atrial fibrillation. Then it dislodged from the left atrium, then enter into the left ventricle. After the contraction of left ventricle, it will enter into the circulation, and gradually it will move through the carotid artery into the cerebral artery. Then it causes a blockage of the cerebral artery. So this is known as this will lead to development of ischemic stroke. Or this clot which enters into the left atrium enter into the circulation. Okay, it may block the coronary artery. So if it is block the coronary artery, then it will lead to sudden myocardial infarction. Okay, sudden myocardial infarction. So here, because of atrial fibrillation, there is a ischemic stroke can also happen, pulmonary embolism can happen, and myocardial infarction. So all three possibilities are there, and they are a very serious complication of a atrial fibrillation. So option for this one is, it is a all the above. Option D, all the above is a right answer here. Okay.